Parts of the Gold T IUD and its insertion device. T-frame or structure. Contraceptive wire. Removal threads. Insertion tube. Body of the insertion device with hysterometry slots 5 to 10 centimeters. Finger rings and top gauge. Rod. Hysterometry plunger with hysterometry piston. Insertion piston with blocking piston and impulsion button. Instructions for insertion. Once the patient is properly prepared, a hysterometry of the uterine cavity must be performed using a uterine sound, hysterometer. If necessary, you can give the insertion tube suitable curvature for better adaptation to the uterine position. This can be done with sterile gloves or without them before removing the insertion device from its packaging or sterile pouch. Then, unlock the hysterometry piston, slide it through the hysterometry slots to the lower position closest to the measurement previously obtained. Lock it back into the slot. With this simple maneuver, the insertion device is prepared for a proper insertion. From the distal end of the insertion tube to the uterine fundus, the Gold T IUD will fit exactly once the rod expels it out of the insertion tube. Once the insertion device is ready, pull the removal threads until the IUD is completely hidden inside the insertion tube. Immediately and carefully introduce the insertion tube with the Gold T IUD loaded into it through the cervical canal until the top gauge of the body of the insertion device presses firmly against the cervix. The blocking piston holds together the hysterometry plunger and the insertion piston as if they were a single unit. This allows the insertion tube to be safely inserted into the uterus. However, until this blocking piston is unlocked, it prevents the Gold T IUD from slipping to the uterine fundus, thus avoiding its wrong placement. Once the insertion tube is inserted into the uterus, firmly grasp the insertion device, pressing the hysterometry piston, and rotate the insertion piston to the left, see arrow, until you note the click. Thus, the insertion device is ready to place the Gold T IUD. Hold the insertion device, placing the index and middle fingers in the rings of the body of the insertion device, and the thumb on the impulsion button. Keeping the top gauge pressing firmly and steadily against the cervix, press the impulsion button to slide the insertion piston to the end. After this operation, if the prior hysterometry has been correct, the Gold T IUD will have been surely implanted into the uterine fundus. You have to be careful not to put pressure on the threads when holding the insertion device and monitor their correct passage through the hole of the insertion piston. Remove the entire insertion device by making a slight rocking motion to enable the threads to slide into the rod. Cut the removal threads about 2 centimeters outside of the external os, thus concluding the placement of the Gold T IUD. It is very important to note that the non-release of the blocking piston will not allow the correct functioning of the insertion device and consequently the Gold T IUD placement.